I'm Mike Fusek. I'm a pharmacist here in town. I'm currently working with Maria over at Hoffman's Pharmacy. She's owned it for the last several years here and doing a nice job here in the community. We're trying to be a local representative for everyone here in town. And if you have any questions, feel free to stop in and see us sometime. So vaccinations, we're here to talk about vaccinations today. Primarily probably the flu, the pneumonia, and the shingle shots. So if you guys have any questions afterwards, we get done, feel free to throw them away. I'll see what I can get into with you guys. So why do we vaccinate? Anyone know? Pretty much it's to avoid those preventable diseases. They found a treatment and they found some possible way that our bodies will actually avoid getting something. There are some vaccines out there that won't prevent, but more or less likely just lessen our general response to something so that we can get over it naturally or get over it without having a true hospital admission or other medications being needed. So that's really the reason that we kind of vaccinate, just to make ourselves healthier in general overall. There's a lot of documentation out there. Vaccines decrease the overall medical cost too to our society, which is a big thing right now with all of our healthcare systems. How are we going to reduce overall medical costs? They show that preventing something is a lot cheaper to treat and pay for than actually actively treating a disease or actively treating an illness. So that's the other kind of reason why vaccines have become more prominent here in the last 15, 20 years. They've been very aggressive due to all their research here in the last 15, 20 years about being proactive with their vaccines. Up till about 15 years ago, where would you go to get vaccination primarily? Only really the doctor's office. Now you can go to the health department, pharmacies, there's representatives at churches, representatives in the malls. They're really everywhere right now. And it's just more or less they're trying to promote that new healthier lifestyle that we're out there looking for. So, briefly I'll just kind of go over some of the history of the flu, since that's the more common vaccine that's out there being promoted right now, since we're getting into the flu season. They actually released the flu shot around the middle of August now. So most locations will start getting vaccines around the middle of August and available to our public here in the States anytime thereafter. Our true flu season doesn't start until probably October, November, and it carries for 3 to 4 months. The researchers and scientists are actually always constantly looking towards Asia, believe it or not, to what flus will be affecting our culture here in the next 10 to 12 months. So they're already looking over in the Asian markets, seeing what flus are actually infecting their population. And then they know just through well-documented flow of the virus itself west that we truly won't see it for about 8 to 10 months just through traveling or importing and exporting. So they give a little bit of a time to actually research what more popular strains of flu are out there, what we need to be cautious of, and then hopefully by the time it hits us, we have a true effective vaccine that we can give to our population. So does anybody know how effective a flu shot really is? Anyone? Last year wasn't the best year.
No.
They said, I think overall it was like 36% effective. So, 4 out of 10 will round up maybe. Interesting though, that same flu shot, they said for children, the ages of 6 to 8, it was almost 70% effective. So why is it more effective in a 6 to 8-year-old versus a older adult in general, or the adult population in general? That's something interesting to see. No good answers on that now. I'm sure they're looking into that. Why is that? But there have been years where there was 60% effectiveness. It really just depends on a number of things. So what makes a flu shot effective versus not effective? First, did they select the right viruses? Did they look at Asia, figure by the time it came over? Did they select the top, more common viruses? Maybe they did, maybe they didn't. When they were actually preparing the vaccine for delivery, did the vaccine actually end up with what product they were wanting? They start off with a virus, they typically culture it in a controlled environment. They grow most of the flu vaccine in eggs. So that's the egg allergy that everybody's always asked about before they get the flu shot. So they traditionally always have used eggs to kind of harvest the vaccine for our flu shots here. There are new techniques out there now to avoid some of the flu or the egg allergies. I apologize, and that's a new upcoming way. And they've actually found that it's a more consistent way of releasing the vaccine. There's a lot less uncontrollable factors to where the virus would maybe change through the growth process before it was actually prepared for the flu vaccine. Another thing that kind of affect overall effectiveness is our general immunity. Were we prepared to get the flu shot? Were we at our most, our best situation to actually build immunity against the vaccine we're getting? That questionnaire that everybody fills out before they get a flu shot, it's not so much to prevent you from getting a flu shot, it's more or less to make sure you're going to build your maximum immunity to that flu shot that we're providing today. I don't want to give you a flu shot after you've had a cortisone injection from another doctor where your immune system's possibly hindered from that cortisone. A steroid would actually lower your overall immune system temporarily, and so if I would give you your vaccine, you just won't build your immune response for down the road like you should. There are certain medications that you can take that would actually lower your overall immunity. Say you're in chemotherapy even. A chemo patient would not have the immune system at the moment to build their maximum response. It's not going to be harmful for you to get the flu shot, but it would possibly inhibit your maximum immunity that you could develop there. So, some things to think about. Let's see here. So, the types of flu shots that are out there. There's a common traditional flu shot that's been around for years. It protects you from 3 different types of flu strains virus that was identified, and that's what's primarily always been available up until about the last 10 years. Has anyone heard of the high-dose flu shot? It's not required as we turn age 65, but it is recommended. The reason that it's recommended is it's actually a double concentration per se, just for general purposes. It's a loaded dose of flu vaccine that's not harmful to you, but it helps the body build its response similar to how you were at the age of 40 or the age of 35 or 50. They show as we get older, our immune system doesn't work like it used to, as we all know probably. Nothing works like it used to. However, you know, they can do things along the way to kind of help oversee that and help give you the opportunity to build your immunity correctly. And so that's where that high dose shot has kind of come in as a unique niche. It still protects you from 3 strains of influenza. However, it's a little bit extra there. Not necessary in a lower, like say someone younger was to get the high dose. I don't think it would be harmful to them, it's just not necessary. There's not really a need for that. And finally, there's a newer type of flu shot that's been, is that 6 years, 7 years, I believe. It's called the quadrivalent. And so it will actually protect you from 4 different types of influenza. It's a more thorough way of developing the flu vaccine itself. And so I think that's probably where things will be going down the road. They don't make a quadrivalent high dose yet. I could see that maybe being a situation where down the road that might be what they're developing. Why not protect from 4 strains versus just a traditional 3, if it's possible. So, not happening yet, but down the road you never know. As far as over-the-counters and supplements, how does everybody fight off the flu if you get it? Or how does everybody treat symptoms? Anybody have any go-tos? Chicken soup. Anything in the aisle of NyQuil, Tylenol, anything like that. I mean, all these, there's so many different things available. I just want to take a moment to make sure everybody understands. We do, as a population, take a lot more products during the wintertime and flu season to kind of fight off stuff. Just be careful. There's a lot of Tylenol in a lot of these products that you're taking, whether it be Theraflu, NyQuil, Dayquil, Coracetin, HBP. For those, anybody taking Coracetin, HBP before? It's for the high blood pressure patients that are out there. All these products have Tylenol in them. So you just got to be careful. Are you really in pain? Do you need Tylenol, or do you just need some other possible, maybe an antihistamine or decongestion to just get over what the symptoms are that you're trying to treat versus the Tylenol? So Tylenol's great, but we just don't want to make sure we're getting too much of it there. There's a trend where everybody's taking everything to try to get over what they're going through during the wintertime here, and there's some signs and some trends showing that people are getting too much Tylenol, and it's actually affecting the liver. So we want to make sure everybody's out there not taking too much of anything. Everything in moderation. And if you have a question, come talk to me. We'll figure it out. So, other reasons that we need to use herbals or vitamins or natural supplements is try to offset our general immune response. We want to make sure we're able to fight off anything. What are some things that affect our overall immunity as we're doing the day-to-day operations? Our age, we can't really do anything about, but like I said, the older we get, the less apt we are to fight off some things. Nutrition is a big player. You know, there's a lot of things that we just don't supply ourselves naturally with our nutrition. And of course, as we get older, our diet stays the same, or it decreases. It typically decreases. So we want to make sure there's products out there that kind of offset that. So nutrition is very important. Lack of sleep. Everybody's busy. No one can sleep like they used to. No one gets enough sleep. A lack of sleep also affects our general immunity. Another reason to kind of consider some over-the-counter and some supplements. Like I said before, medications. Medications affect our supplements. Diseases. Many diseases out there will decrease your overall response. A lot of the autoimmune diseases, inflammatory diseases, rheumatoid arthritis, Alzheimer's, asthma, diabetes, cancer. There's a bunch of things out there that, and I'm sure you're well aware of it, but those can all affect our immunity. So we've got to keep that in mind and give ourselves some more reason to kind of look at what we're taking in on a daily intake. Weight, of course. Being overweight, not exercising. There's a trend that shows if you're exercising, which is good to see everybody here. If you're exercising, doing what you can, you know, that also boosts your immune system. So there's a lot of things that we can do, but there's also some nice herbals and some supplements out there that we can do. So the healthy diet, that's self-explanatory. There's a lot of things out there that we can do to supply ourselves with nutrition. But anyone take a multivitamin? Do people take multivitamins? That's very good. And you want to make sure your multivitamin that you're taking, it has minerals and trace elements in it. They've kind of shown that you need more than just A, C, B. The essentials, there's some more minerals out there that they have shown behind the scenes to keep the cells growing the way that they need to be, regenerating themselves, really boosting that cellular health there in the small micro level. B complex with vitamin C. That's a good thing to take occasionally in this time of year if you're not already taking that. I wouldn't, everything in moderation too, everyone. Just don't start taking 15 supplements every day because you have to. But just in general, you know, you want to make sure that you're supplying yourself with the necessary things to kind of keep going. So multivitamin is good. A B complex is good. There's some echinacea. Has anyone tried echinacea before? That's a unique thing, and it's clinically proven that it actually will boost your immune system response. So to take that daily is not a bad thing, but it also isn't necessary daily. You know, if you start feeling something come on, definitely something to kind of consider. Elderberry, believe it or not now. They found that elderberry is a natural antiviral, fighting off the flu, fighting off viruses in general. So again, something not to take every day, but if you start feeling down, it wouldn't be a bad thing to consider. Zinc, everyone has probably heard about zinc for fighting off colds and keeping healthy. Now, I don't think you need to supplement daily with zinc. However, it's a good thing to know to run to down the road. Like Zicam and all those products, most of those all have zinc in them. Airborne is another one that has kind of a product where, you know, there's zinc and other clinically proven things to kind of boost that immune system when you're starting to feel down. Selenium, that's another trace element that they've shown to kind of boost the immune system. That's why I think if you do get a multivitamin that has a mineral base and some elements along with this, some trace elements, not a bad thing to look into. You can go overboard with some of these multivitamins too, because you can go from the one a day typical Centrum, you know, to something more advanced at General Nutrition or any other pharmacy here in town where it's 3 or 4 doses a day. I don't know if that's necessary in most cases, but there's all kinds of options out there, and that's where people kind of will do their own research and feel what's right for them. Something new, everybody has probably heard about this probiotic kit. Probiotics are still out there. They're still developing where they're going to go with this because there's multiple uses that they found and multiple positive benefits for the body. As far as for what we're talking about today, they're showing that actual probiotics have some colostrum in them, and colostrum is similar to like a nursing mother providing the breast milk for a newborn and passing the immunity on to the newborn. Colostrum is what does that. So it passes antigens on to the newborn. In the same way, they're showing that probiotics actually will do that too to kind of boost that immune system. So if you're one of those individuals where you have a lowered immunity level, it's not a bad idea to kind of consider that to kind of pump yourself up. Or if you're going through something and you want to get your best opportunity to kind of rise up, it's not a bad idea to consider that. There's a million options of probiotics out there right now, but the more important thing, I guess, would be more supplementing it with what you would feel acceptable for, I guess. And there's a range of prices too, so we could find something that we could go that way. And other option, I guess, that I've also heard people using is activated charcoal. Activated charcoal is a binding agent, and I've heard when somebody gets sick, they feel that there's something floating in the blood, you take activated charcoal, and it would actually bind to whatever is not traditionally in the bloodstream, and actually pull that out of there and shorten the duration of an illness there potentially. It's a concept. It has been proven that it does help bind things. You just got to be careful if you're taking daily medications also. It will bind those medications too. So you don't want to offset some of your prescription medications with some of your natural supplements. So there's a fine line there too. So any questions about the overall flu shot or anything at all? That's pretty much all that I have prepared. I figure we're just going to throw some questions and answers out and see where we go. Yes?
Okay.
Yes.
Why are so many doctors and other people opposed to all these vaccines?
Right. It's a good question.
I know.
There were years where they were, I guess back in the early development of them, there were a lot of old style thinking of how to prepare a vaccine. They're kind of culturing things and making things a lot differently in the last 15 to 20 years.
Okay.
My wife actually has an autoimmune situation, and they're not so sure that maybe it was a vaccine back. But everybody's different though at that point in time. So there's a thought out there thinking that vaccines can create some harmful immune issues down the road also. But one would have to be susceptible to that first before I guess we would truly know that. So you do need immunity. There's a huge push, I guess, nationally to get the vaccine, but it really comes down to you individually at that same point in time. So am I going to make you get a flu shot? I'm going to ask you, but I'm not going to make you. As far as an individual, I think there's a certain time where you're not necessarily going to need a true vaccine because it's not going to be beneficial to you at the moment.
All right. If you're the protection, we'll just talk about
Sure.
the flu vaccine.
Mm-hmm.
We're all going to get exposed to it. We go to grocery stores, we go to doctors' offices, taxi cabs, anything.
Yes.
So, how much does this flu vaccine protect you when actually we're exposed to it everywhere we go? We're exposed to it right now.
Maybe as a younger individual, like 20s, 30s, 40s, maybe it's not as crucial. I don't think they're out there they want that person to get it. However, that immune system typically is healthier than someone getting older. Now, if we can prevent an illness, if we can prevent a long-term stay in a hospital, a long-term duration of doctor visits, just a quality of life decrease for the short term even, that's what I think it's out there for. I don't think it's out there to be a life-saving event for everyone as a whole, but I think it's just there for a general individual to do the best they can for their general well-being. I don't know how your exposure is going to still allow you to get the flu, but maybe it was a flu that you could protect yourself from and you wouldn't even know that you were getting it. That's why I think the effectiveness right now would be, if it was last year 37%, it's still some people that did not actually have to go through the whole flu. And you can only do so much to control your exposure. From the mask to the clean hands to, it's just, you've got to be the best preventator that you can be.
I have one more question.
Yeah, no, you're fine.
I don't think I've ever had the flu. How do you know it's the flu?
Truly, you have to do a blood test. you really would have to know. Other than that, it's really a guess. They know the signs and symptoms of a flu, whether it be the fever, the malaise. Sometimes you get the nausea and vomiting, but more of the fever and the muscle soreness is what actually, I guess, would trigger that you would think you'd had the flu. So, I don't know how to, that's really the blood test is the true way to confirm that you did have the flu.
What numbers in the fever?
High, spiking high, yes. 103,
Oh,
102,
really?
yeah, typically. And a lot of times you think of it, you go through it one day, it's no big deal, and it's gone. Well, that was a virus, that probably was a flu virus most likely. That was actually creating that. It wasn't something that, someone would linger with for multiple days. Usually it's a coming on, you can start to feel the soreness, the achiness, the fever would spike, just sleeping is a lot better than being out than active. Just more of the signs and symptoms than anything else.
Okay.
Yes?
One of the companies we work with requested the nasal flu
Okay.
vaccine,
Mm-hmm.
and it wasn't available.
Right, it wasn't effective for a couple years, they really missed the mark, and it has a lot of bad press for a couple years. Supposedly this year is back in action, and they're more confident as far as their overall results and their forecasts as far as what they feel. It's a lot more convenient now than those individuals or two of those individuals that are needle phobias, I guess I should say. I feel that I do a pretty good job with the needle, and most people are, oh, that was it, no problem. And I mean, we've come a long way with how we administer the vaccines. However, there's still that phobia of, I don't want a needle, I don't want a needle. And I feel bad for the poor little 2-year-olds. They have 16 to 20 vaccines by the age of 24 months. It's like every time you go to the pediatrician, I mean, they got a bad rep to start off with, I feel bad. But I think that was like the real niche for the nasal, was just to kind of allow someone the opportunity to get a shot or a vaccination without actually having a shot. So,
Is it as effective?
they're forecast up to this point, no. They're forecasting this year. They feel as though they've gotten everything together. So we will have to see, unfortunately, next year. So, but it is an option, and it's better to get something than not get something, especially if you're in one of those situations where you're prone to getting an illness or, I guess, a bout of the flu.
But it's basically for people who have needle phobia.
That's the primary niche. Yeah, that's the primary.
I have one more.
Mm-hmm.
This is neither here nor there, but one of our members had a flu shot,
Mm-hmm.
and her arm,
Yeah.
and it turned out she ended up with a staph infection.
Really?
And someone told her maybe she took that Band-Aid off
Yeah, you want to do
too
the.
soon.
I mean, we're very careful about how we do it. It's stored in a controlled environment. We're using alcohol swabs in most every situation that I can. I do it before, I apply it to the skin, I give the vaccination, and then I actually wipe it off again just to make sure nothing hinders around that injection site. There's actually a new vaccine, Band-Aid. I don't know if anybody's heard about this or seen this. It's about the size of a quarter. It's a cotton area on the outside of the circumference of the actual Band-Aid, and then on the inside is just a clear mesh. And you put that on the skin after you wipe it down with an alcohol swab, and then you actually can go through that clear mesh with the needle. And that way, not everyone bleeds, or even people that are on the warfarin or a blood thinner, not always will they bleed, but it may occur 5 to 10 minutes after the injection was provided, and you're on your way home, and oh man, I'm starting to bleed. That little quarter-size Band-Aid is kind of a unique concept there. So, kind of a unique idea to keep the area clean and protect you from anything most time ago. So, there's anything that could happen with a vaccination. We've been real lucky. I've been doing them for 15 years now, for quite a number of them every year recently. Every year seems to increase as far as the number of shots we're providing at a pharmacy. And we've been very lucky up to this point to avoid any needle sticks or anything like that. I mean, there's a lot of things that could go wrong, and you're prepared for that. However, you want the best individual response. You want them to come back every year and not be afraid of them. So for something like that to happen, I feel bad. I've seen some swelling, some redness. Now the shingle shot, that is one that it's a little bit different of a vaccination. So you do see some true injection site reddening areas. Most of the time you just get some soreness because you're truly penetrating the muscle with these shots. So you're gonna have some tenderness, some soreness, and hopefully we keep moving on because that's it. We don't want to see other further reactions. We've seen certain individuals kind of knot up in the area, and a lot of the times it's just, we do our best to be consistent, but you're gonna have that one or two situations where we gotta work with what we get there.
Since you brought up shingle shots.
Yeah, let's talk about pneumonia shingles.
Yeah.
Feel free to ask away. Yeah.
Those of us who have the shingle shot, we were told, you're good. Now find out that.
So you never were truly good. They were saying it was always like, as far as when we had the Zostavax from years ago, you know, I think they said it was always like a 65% chance that you wouldn't actually get the shingles. So if you were told that it was foolproof, it's not. It never was meant to be that. And I was always clear about that in the first place. The way that it was presented to us through the manufacturer, it was a 65% chance reduction. And then if you would actually get the shingles, it would be a lesser response, lesser duration, lesser severity. And that's the whole vaccine concept that we initially talked about when I opened up here. So hopefully even if you would get it, you were not going to get that severe, lingering shingles vaccination or reaction that you have read so much about or seen pictures of. That's been up to the last year. So we've always had Zostavax and that's it through Merck. There's a new shot out there called shingles. It's an intramuscular injection. Zostavax, the one up to this point, has always been just underneath the skin, a subcutaneous injection. The shingles now is intramuscular, and it's a 2-series vaccination. So you get one, and then within 2 to 6 months, you have to come back and get the second vaccination. They're claiming it's 90% effective, 95% effective. The problem is it's not available at the moment. The manufacturer underestimated the overwhelming demand, and it got to a situation where they kept giving everybody the first shot.
Right.
The second shot was coming out, and I'm due. It's on back order. Well, now what? You know, they have 6 months to try to get that shot, or that second shot to you, so there's been quite a dilemma. I personally am not even giving the shingles at the moment because I can't guarantee when I'm going to get another supply. I was just on the phone last week with the manufacturer, and they said by the end of the year, in the first of the year, it'll be a readily able supply. So it's still a newer vaccine. There's a lot of people that have had their second shot, but there's a lot more people out there that want to get it. We just can't supply it on a consistent basis to be able to offer it every day. We're showing that it's going to be a little more irritation to the injection site than what the former shingle shot was. Some more redness, some more irritation, but I guess if you're increasing your chances after the second shot to a 90% effectiveness rate, that's not a bad shot, or not a bad option. You can see shingles linger on and on for months. I really feel bad. You can see it in the face. It just really gets intense sometimes. And it's,
Sir, what is the percent? I mean, I've never had the shingle shot, and I've been asked, and I've said no.
yeah.
But what is, I mean, I guess the odds, I guess, or
It's
what is
kind
the,
of,
like,
you know,
it's
it
a
really
hit
takes
and
that
miss?
opportune time to come out. It seems like it comes out in a stressed individual or a low immune response, and it's a reactivation of the chickenpox virus from when you were younger. Now, most children that are 14 and younger, 15 and younger, they've had the chickenpox vaccine.
I have, that's what, isn't that the scarring vaccine?
No,
No,
it's
no.
only been available recently.
Okay.
And so this shingles, hopefully, when we look on it as a whole 50 more years down the road, hopefully it'll be pretty much eradicated technically because of the fact that no one will have ever had the chickenpox down the road. But there's a narrow window of, you know, everyone that's, say, 20 years and older that has had the chickenpox, and that could be a reincarnation. My wife actually had the shingles when she was in college. She got it during her finals week, and she was stressed, lack of sleep, and that seems to be where shingles kind of pops. It's not just somebody that's healthy and running around.
It's not
You
an
hear that case.
exposure.
It's not an exposure type thing. It's more of your body being susceptible to that virus coming back out. So, yes.
If you don't know if you've had the chickenpox, like our generation,
Sure.
is it still?
It's not harmful to get it. No, like you can be. It's as far as we've been told, it's safe to do that. But most everyone has had the chickenpox up to this point. It's just, I mean, you can remember. I can remember going through elementary school. All of a sudden, the class went from 22 to 8. You know, and here it comes. It's just a matter of when you actually get it. Those days, I think, are gone as far as elementary schools and whatnot. But most of the time, it's just with the commonplace to think that, yes, I did have the chickenpox.
Do you recommend getting the shot now, the first shot, and then hopefully we get the next one?
I can't even get it in right now. I have
Okay.
0 in my inventory.
Go
If you
for
can find
6
somebody, yeah, sure, that would be, yeah.
If it goes past the 6 months, then
Then
you
what?
have to start all
That's a
over.
good question. I couldn't get a good,
Yeah.
well, we're looking into that, so.
We gotta get it.
That's what
First shot.
I just feel best. I mean, it'd be, we're gonna, roll the dice and hope by January, you're gonna not get the shingles. That's kind of like the thought process.
How do you know if you have the shingles? I don't even know what it looks
They told you all.
You'll know.
like. What do you mean?
It develops in certain areas, a really intense pain. It's a nerve infection more than anything else. So it comes out where the main nerves are, so around the waist typically, or the, the trunk of the body. It can radiate up into it really is a nasty, gnarly type of reincarnation
What
of
does it
chicken.
look like?
Just a real reddening. It's not so much chicken pox at all. It's just a real intense red rash and painful. That's what they say. It hurts all the time and really lingers. It doesn't ever go away. It just throbs and
If you get the shingles once, can you get it again?
anything's possible. So that's what you're giving. Technically, you're giving yourself the vaccine to not get it.
Mhm.
Well, you still can get it. It's just
Yeah.
it's possible. It's possible. Yes.
And I think I heard that that vaccine is not covered by insurance.
That's the first shot, Zostavax that was available 10 years ago, 12 years ago. It was terrible coverage. It's like $250, and people were saying, you know what, it's still worth my time and effort to get one vaccine, reduce my chances of getting it 65%, and pay the $200. It since has been covered very well. I can bill most prescription plans at the pharmacy, get it to go through for pretty much nothing, maybe a $40 copay. The new one is not as readily acceptable, but I'm gonna say it's gonna trend out to where, it's gonna come back down to having another $40 copay. It's just a matter of when that happens. So, some insurers are already accepting that it's cheaper to pay for the $200 or $250 shot twice versus have the patient come back and get antivirals, pain medications, copays at the office visit. I mean, as a whole, as a healthcare system, it truly is much more practical to get the shot, pay for those 2 shots right up the front, and then have to worry about all the lingering office visits and medication they would have to pay for if there was an outbreak.
So kind of like in a lingo right now, where do you get the first shot, don't get the first shot, get the other shot? What do you do?
I know.
Flip the coin and say,
Yeah. There's no harm to getting the traditional shingle shot that's always been available. You could go ahead and we're only talking till January 1st, and they're very confident about having it in January. So I would say if you can find one in town, if you want to get one, that would be fine. Yeah. And then I figure you got a total of 3 months of leeway where you got to scramble for that second shot. Because come January in 3 months here, or 2 months, you still got some time to play with. Questions about pneumonia?
Yeah.
Has anybody ever had a pneumonia shot? Okay. Did you have it in the last 5 years?
Yes.
Okay, so you probably got the newer, improved 13, Prevnar 13.
Yes.
It's pretty much canvassing the television reading. And that's good. That's what they're recommending.
Oh, no, we didn't get Prevnar, we got.
And there's Pneumovax 23 that's always been available.
That's 20s.
And you would want to wait at least a year from the time that you got your most recent pneumonia shot to get that new Prevnar 13.
Okay.
Prevnar 13 is still approved for 65 and older. We can give it anywhere, whether it be a pharmacy or an office visit.
Mhm.
However, if you come to me right now and say, I've never had a pneumonia shot, and you're of the right criteria, I would only give you the 13 right now. They're saying that's the more crucial of the two. You still are able to get the other Pneumovax that's always been available up to this point. The Pneumovax, they were always saying, one vaccination and followed 5 years down the road, the
Yeah.
second vaccination. That's always been the right way to go about it. This new one is kind of trumped that though. So they're saying once and done with that. And it's only protecting you from 13 types of pneumonia, but it's a newer, more updated types of pneumonia that they're preventing it from. So, but it's still safe to bolster yourself against the other types of pneumonia with the other vaccine.
Well,
And
I
insurance is
have
still
to go
covering
to
that.
the next my 5 years are up next year. So, I had it in 2014.
Mm-hmm.
I
I would
just
go ahead
got
and
his
give you
yesterday. Anyway,
I would go ahead and give you the Prevnar 13 now.
pardon?
I would go ahead and get your Prevnar 13 now, because it's completely
They
us.
told me no, they can't,
You could.
not until 2019.
I'd have to see the record, I guess, just to see.
Pardon?
I'd have to see your record just to see, to make sure then.
Is it the insurance that's telling you you can't get it?
No, not the
Or it's
insurance.
the health?
It's the pharmacist that said, I'm not due for it again until next year, which is right
I
around.
guess I'd have to see it completely to make sure which one it was initially, just to make sure. Because if you would have had
It's
us,
the 13 that I have.
oh, if the 13, then that's correct then, yeah, that is correct, yeah.
But you know, once you got it, you don't have to get it again, do you?
Correct. Once you have it, you're done.
The 13.
The 13, yeah.
Do you recommend the pneumonia?
Pneumonia shot for sure, and no doubt about it. Pneumonia can be so breaking down in the body, it can take 6 to 8 months after you get treated and overcome pneumonia to truly regain the capability of the lungs there. So it's definitely, it's a terrible thing, and you want to try to avoid that if possible. That's definitely, and it's very clinically proven to actually increase your chances of overcoming those types of pneumonia there in a healthier way than if you didn't have it. So,
And what age do they recommend that you get the pneumonia shot?
so they're saying 65 and older. However, if you have any, they call it complicating diagnoses, whether it be asthma, any chest COPD, or diabetes even, certain things like that, they'd rather you have the pneumonia shot than not have it. So they go ahead and include anybody with that type of
Because I got it back
morbid
when I was
disease.
in school, when I was teaching.
Sure.
And I'm trying to, and then when I had an accident, they were saying, do you have the pneumonia shot? And I go, well, I had one. Well, it's
Yeah.
no good anymore. You have to have another one. This was a long time ago, and I just couldn't remember when it
It
was.
seems like the hospital systems right now, if you're admitted into the hospital and you had your pneumonia shot but you can't remember when it was, they'd almost give you another pneumonia shot just to make sure.
Okay.
Now, I don't think there's a harm in doing that. We at the pharmacy, we had to kind of keep our records a little bit more, so we would follow more of a standard guideline. But in a situation, inpatient, I think they're more concerned about helping you out the most that they can. And if you can't remember when you got your pneumonia shot, you're probably going to get your pneumonia shot, just to kind of boost up your immune response for down the road.
Because I think they were telling me it's within 10 years I could get it again.
Yes, yeah, just,
But I was saying, gosh, when did I get it? But it was way beyond 10 years.
right,
It's just, I was in the hospital and I just couldn't,
that's what,
I just couldn't think.
right, and that's what, they just want to make sure it's better to get it than not get it at that point in time, for sure.
Mhm.
Yes,
I want to ask about a tetanus shot.
okay.
I probably haven't had one forever.
You can get
I
it,
mean,
right?
it's been a long
Yeah.
time. How
Yeah.
important is it to have a tetanus shot?
It's important. I mean, it's another thing that it does wear out over a certain time. They say every 10 years you're supposed to get it. So now they've included it with pertussis because there's been a slight increase in pertussis across the nation as a whole in the last 5 to 10 years. And I think a lot of it is because people weren't getting that revaccination. And not that an adult is going to get it, but it's going to carry it to children. So that's what they're worried about, somebody that hasn't yet been vaccinated, so more as a carrier than an actual, I guess, you yourself getting the
The
pertussis.
pertussis is at the whooping cough?
Yes, yeah.
Okay.
Yeah, and so it sounds terrible. I do see little kids coming with it and you feel bad because there's just not much you can, there's medication-wise, there's not much you can do. You have to let the body get over it.
Would we just come in and say
Yeah.
we wanted a tetanus shot?
We work under a protocol. The State Pharmacy of Ohio, State Board of Pharmacy of Ohio has been very proactive. Ohio's really unique with their pharmacy acts as far as how they've been working with physicians and working for just general populations as far as making them healthier. And they've been very good at letting the pharmacist do most vaccinations that are available. There's very few vaccinations we can't do, believe it or not. We operate with a physician typically in town, but they do have clinical physicians at the State Board of Pharmacy that you can work with to approve your immunization and vaccine program. And there's like yellow fever. We can't do a yellow fever vaccination. There's a couple other vaccinations for if you were traveling to Africa or traveling to Asia. that we can't quite get into. There's some blood tests and some other diagnosing that has to go in. And another thing is, the time schedules for a lot of those travel vaccines are very crucial. You don't want to do it too late and not have that vaccine active and fighting in the body for when you actually get exposed. So the timing issue is a crucial thing. But for the most part, like tetanus, yes, you could come in tomorrow, we could, yeah. Yes.
One last question.
Sure.
The only vaccines I've ever had were smallpox,
Yeah.
the polio vaccine, way back when they gave it on a sugar cube.
Mm-hmm.
I was still in school.
Mm-hmm.
And then the pneumonia and shingles
Okay.
and flu. But I've never had, but I've had all the childhood diseases. and that.
Sure, sure.
So where's that leave me at 70?
You're probably mostly
You know,
self-immune or self-generated immune system. You've done a lot of it on your own, building it. So really, you're maybe a hepatitis shot, but if you're not around bloodborne agents, and there's not a reason to have a hepatitis. So I would be more than happy to provide you the hepatitis vaccination program, but it probably wouldn't be necessary. Everyone in the health field now does have the hepatitis vaccines. The children now are being vaccinated against hepatitis, just because they've shown that it's better to get it done out of the way, remove the whole question, than to have to worry, did I ever have that? Did I have that? You don't want to have to go get a blood test to find out if you have the exact immunity needed to fight off some of these infections. So, but I think you're probably pretty good.
Thank you.
I have a
Yes.
comment question.
Yes.
She wants to know, can someone get this multiple vaccines in the same day, including flu, pneumonia, and shingles?
You really should space them out. If you came in today for your flu shot, I'm probably going to say, are you interested in getting your pneumonia shot, or have you had your pneumonia shot? 2 of them are probably your max that you really want to do. The shingle shot is kind of unique. You can get the shingle shot with your flu shot the same day. If you want to think about the shingles and come back, it has to be about 30 days after. For some reason, they've shown that if you would come back in a week or 10 days after getting the flu shot, you're not going to develop your immunity correctly to the shingles. So it's a timing issue with a lot of these vaccines, and a lot of it's just how the body works and how it operates. I would encourage no more than 2 at a time in most situations. I just had a patient come in saying that they received hepatitis, pneumonia, and tetanus and pneumonia and the flu in the same day. I'm like, oh, just from my training, I was always told that it was 2 at a time. So I'm sure anything's possible. I am not really researching that, but I'm more of a slow, steady. Like I'd like to take my time, make sure everything develops correctly, than to rush things.
I was gonna do that, and they told me, well, how about if we just.
It's really, if you don't mind having the timing, I'd rather work with you and get it done
And I
correctly.
did, I don't wanna get any of them, to tell you the
Right.
truth, but.
I understand. I understand.
And then I got sick
Yeah.
that day.
Okay.
So, and I had both of them.
And that's a lot. Yeah. A lot of times they say, "Oh, I don't get the flu shot because I get sick." Technically, there's really not a way to do that. What could happen is, say your body was fighting something that you didn't really even know about. I give you the flu shot, the body's more concerned about fighting and building immunity to that flu shot than what it was fighting off initially. So it probably was something that the body was fighting you didn't even know about that came out.
I know, because after that I said, because they used to bring it every year, the flu shot to the schools, for the
Yep.
teachers. And then after that I said, I got the flu, I'm not getting any more flu shots. And then I became really good friends with the nurse, and she berated me.
Yeah, I
She
know.
says, you did not get the flu from those shots. But I thought maybe because I got them both together, but
And
you're
that's-
saying.
I think a lot of times it could be something behind the scenes that you didn't even know was out there or exposed to, that your body was fighting just fine, and then you kind of threw a wrinkle into it and it came out of that.
Yeah.
How come the government, when you go into service, they give you 21 shots?
And just, it's how it is.
And then you go on this side.
They're toughing you up.
Yeah, no,
Yeah.
no, you're right. Yeah, they did the lineup. You just walk down and boom,
Yeah.
boom, boom,
Yeah,
boom.
you got here, and
I know. But a lot of those, some are bacteria, some are viruses they're treating you from, some are just preventative too, as far as other agents that you'll be in contact with. So there must be some different thinking there. I'm not exactly sure. But
Yeah,
then again, I guess it's
thinking.
better to try it and protect yourself versus to have to worry about it after the fact. So,
I probably want all those shots. if I was going in.
That's true too. Yeah, I think they have the best interest.
They'll give it to you.
Yeah. So, what else? Any other questions?
Wow.
Oh, good.
Thank you very much.
Thank you.